Well, good communication is absolutely essential to have quality and safe care. It's been said that without good communication, without language, there's no difference between medicine and veterinary science. Well, lungs are lungs. So if somebody asked me, what is the difference? Lungs are lungs if you're Anglophone or Francophone. That's what I'd say. But that's not the question. The question is not what is a lung. The questions that need to be answered are, what are the symptoms the patient is having with his or her lungs? What's the history, right? What's the history of the disease? If a diagnosis is being made, what's the treatment plan and does the patient understand it? So if questions about lungs, which most of us really don't feel that embarrassed talking about, present those kinds of difficulties, think about whether it was a mental health issue. Think about whether it was a reproductive health issue. Somebody was worried, for example, that they had a sexually transmitted infection or that they might have HIV. How much more difficult would it be in that situation? Well, if we don't take into account the particular aspects of a Francophone's culture in a healthcare context, it's the same risks as it would be from people from any other culture. We know from the literature that if patients feel their culture is not understood, is not taken into account, they're not as satisfied with their healthcare providers, they're less likely to follow the prescribed treatment, they're less likely to come back, you're more likely to have a system of, doctor shopping and going on. So if the trust is just not there, if people feel their particular background is not respected, it poses a number of risks. And I think what people think of most often are risks in the hospital or in an actual medical situation. And certainly there are a number of risks there. There's risks that patients won't understand the procedure, so they won't give informed consent, so that's a legal risk. There's a risk of breakdown of confidentiality, which is also a risk for the organization. There's real risks of misdiagnosis. There's risks that patients won't understand their condition and so won't follow a treatment plan. So there's real risks, additional risks of complications and even in the worst cases of death. But there's a whole other area where patients are at risk as well, and that's before they even get into the medical system. Because we know that patients that have that face language barriers are less likely to have a regular provider. They're more likely to avoid preventive care. They're less likely to participate in health promotion programs. So if we're looking at the health of the whole population over a long period of time, they're more at risk of ill health by failing to participate in those kinds of programs. So in Canada, for example, the rates of participation in cancer screening programs are far lower with people who don't speak English, which is a risk, for decades to come. When we plan interventions, that we plan them based on what the evidence is. And there is so much evidence on what the risks of not addressing language barriers are. But it's what people often call soft science. We find it easier to make a decision about what MRI machine to order than to say, well, are we actually going to result in better health and save money to the healthcare system if we deal with language access in the healthcare system rather than ordering another piece of equipment. There's an enormous difference between trained health interpreters and ad hoc interpreters. And often people feel that anybody who speaks both languages can interpret. And this is a grave mistake. It's really important with trained health interpreters that they really are truly fluent in both languages, that they understand confidentiality, that they understand that their role is to be neutral and to accurately maintain communication and not to intervene and sort of put their own opinions in the conversation. There's been some really terrible examples of what's happened when ad hoc interpreters have been called in. You know, patients' private information has been spread around the community. Sometimes children have been used as interpreters and been exposed to really inappropriate information, and really has caused a lot of difficulties within families. There's been major errors in communication. Family members have hidden important information that they felt might embarrass them. One story that really made an impact on me when I first started doing this work was around a woman who had been complaining for years about headaches, severe headaches, and you know, saw all kinds of specialists and finally ended up with a psychiatrist. And that physician said, I want to have an interpreter for this woman, not just the husband. And what came out about that is she was getting headaches because the husband was regularly banging her head into the wall, right? So there's these kinds of examples that we had an occasion a few years ago in a community I was working with where an 8-year-old child was asked to interpret for a mother who had given stillbirth to twins. And it was only when the child broke down that people said, oh, I guess this child needs support too. We shouldn't actually be asking him to interpret for what was really a traumatic event. So a lot of risks to the patient, a lot of risks to the interpreter and to the family, and real risks to the organization, who are not protecting that patient's confidentiality, who are risking, facing risks of liability through misdiagnoses, and for not protecting confidentiality, for not ensuring informed consent. So I think we have to be careful about translation. Some things do need to be translated, okay? Informed consent, right? Statements. Discharge instructions, I mean, really basic things, right? There's a lot of research going on at the moment about unilingual pharmacy labels, right? Because so many people with chronic disease, so many older people are on multiple medications, and we're finding that there's a much lower compliance or adherence to prescribed medication if people don't speak English. One of the things that future healthcare professionals really needs to understand is that there's often more risk in working with a patient who speaks some English than a patient who speaks no English at all. And that's because if the patient doesn't speak English at all, everybody recognizes that there's a problem and they're going to do something about it. They're going to bring in another bilingual provider, they're going to bring in an interpreter, they're going to quite likely run more laboratory tests because they're not sure of what's going on. However, when people speak some English, there's often an illusion that communication is happening, and there could be major misunderstandings. And this is actually a particular problem in an aging society, because we have a number of older people who have worked and lived a lot of their adult lives in English. And everybody thinks, oh, well, they can speak English. And as they start to age, maybe cognitively they're not doing as well. One of the first losses that people often have is those second languages, their ability tends to go down. So frontline providers who are working with older people often notice that they're having increasing difficulty, some of these older people, in communicating in English, even though they'd worked in English much of their lives. And of course, if there's a complex diagnosis, and we know the problem that we're having in Canada now with chronic disease, you know, multiple comorbidities. Some of these diagnoses are pretty complex, right? Or you're trying to make decisions about options in cancer care treatment. Just because somebody can go grocery shopping and, you know, have a nice conversation about the weather in English does not mean that they can understand very complex health conditions and make informed decisions about them. So again, one of the pieces of advice I would give healthcare providers is to say, be especially careful when you think a patient speaks English, and ask them if they would prefer to have services provided in French.